My name is Hinchingbrooke, and this is my colleague Anthony Barabbas. We are both plastic surgeons in Hinchingbrooke Hospital. We've been working here for over a year now, and we are running a new service which is called the See and Treat Clinics, where we aim to see patients, advise them, and if possible treat them in the same setting.
This can be both for skin cancers, but we do also see hand conditions as well. And over the next minute we'll just talk you through the process which is involved when you come to visit us in the clinic here at Hinchingbrooke.
So ideally most of the procedures can be done in what has been called a one-stop clinic, or however you call it, but the idea is basically to reduce the amount of times the patients have to go to hospital. So they come to our hospital, they're being seen and treated at the same time, and follow-up is usually done by letter, which applies to most of the patients. In some cases we need to see patients back for follow-up or for further management, but this has been very well accepted with the patients that we've been treating so far. Usually referrals we get are patients with skin lesions. Now there is a variety of skin lesions. Some can be cancerous, some can be non-cancerous, and some can be in the grey area where nobody really knows what this is. So ideally we should be getting all the cancerous lesions that need to be removed, and also where the GPs have uncertainty about the exact diagnosis. We see patients and advise them, and if needed we can excise the lesions straight away. Give you a little injection, alright?
Okay, yeah.
That might hurt a little bit. Okay?
Yep.
Good. And just clean your skin. Just testing if you feel anything. Does this hurt?
No.
Is it all numb, yeah?
Sure, yeah.
Okay. Essentially we started doing this See and Treat clinics for several reasons. One was to give patients a better service, to enable them to have their surgery done quicker and to reduce anxiety, and we also found that this is reducing the costs, since operating in the clinic room is safe and does not require any dedicated operating theatres.
So the patients have had very positive feedback regarding this, as we send out a letter 2 weeks in advance advising them that they might have surgery, to come in prepared for the need to have an escort possibly with them, take possibly a day or two off afterwards, but it does mean that they just have the single visit to the hospital in which both the diagnosis, treatment and procedure, everything's done in one go, so it saves them having to come back in. And for the hospital, of course, that means we're not doubling up on both clinic costs and operating theatre costs. So there's a benefit to both sides. So we've successfully trialled it, and we've now rolled it out, and we've performed this as standard with a couple of See and Treat clinics per week.